Welcome to Capital Quality's webinar on lesson planning and curriculum alignment. In an effort to provide ongoing support for the Capital Quality on-site administrators, the Office of the State Superintendent of Education, in partnership with Hurley & Associates, is implementing a series of community of practice for principals, center directors, and home care providers. This Community of Practice series is part of an ongoing effort to build capacity and knowledge as it relates to addressing the 10 quality indicators articulated in Capital Quality's Continuous Quality Improvement Plan. This webinar is an edited version and presentation of the Community of Practice conducted on Friday, May 19th and Saturday, May 20th of 2017. This Community of Practice provided participants with a series of research-based practices and activities as it relates to lesson planning and curriculum alignment in the child care setting. It also afforded participants an opportunity to meet and engage in team and relationship building activities with fellow Capital Quality participants and quality facilitators. This is the third presentation in a series of community of practices designed to build the skills and competency level of providers participating in Capital Quality. Over the next few months, we're going to deep dive into each class domain within the realm of teacher-child interactions. Developmentally appropriate practices will be embedded throughout each session. This month's session will provide Capital Quality community updates as well as provide an overview and examination of intentional lesson planning and curriculum alignment. Additionally, it will provide an overview of upcoming professional development opportunities identified by Kids Comprehensive. And lastly, the Community of Practice will include an overview of upcoming community of practices and next steps for the Capital Quality community. During April's Community of Practice, we really focused on teacher-child interactions. Intercity Fund, also known as ICF, provided an overview of the role of literacy and language in early childhood development. ICF, along with participants, also engaged in activities that supported an increased understanding of teacher-child interactions. Please watch April's Community of Practice for more information on teacher-child interactions. It is available on the OSSI website. Over the last few months, we have been working towards points of quality. You have completed the Healthy Tot survey. You have reviewed your existing environments against our environmental survey, reviewed your class, ITERS, and FICRS data, and are in the process of developing attendance policies and adopting revised mission statements. You've accomplished a lot. As we mentioned during April's meeting, one of the things we really want to do is to highlight and honor those providers giving Capital Quality 100% of their effort for the first quarter. Kudos to all providers who have successfully completed the first quarter goals and targets and meeting with your assigned facilitator regularly. Your assigned quality facilitator will provide you with your incentive over the next few weeks. We know that many of you had extenuating circumstances that prevented you from completing the many benchmarks or tasks within QuickBase or meeting with your QF consistently. As you continue to move towards quality and meet regularly with your assigned QF, we will continue to monitor your progress towards quality and will provide incentive cards as benchmarks are met. Today's session will focus on lesson planning and curriculum alignment. Think for a second. What is the difference between a lesson plan and a curriculum? On a piece of paper, write down your thoughts. Think about the key differences between the two. I will give you a few seconds to record your ideas. Okay, what did you come up with? The key difference between a curriculum and a lesson plan is as follows. A curriculum is the entire span of lessons and teachings that your child will be taught during the course of a year. While a lesson plan, on the other hand, is a weekly or bi-weekly plan that falls within the curriculum. Before developing weekly lesson plans, teachers need to know the curriculum and developmentally appropriate outcomes. What is curriculum implementation fidelity? Implementing a curriculum or intervention the way it was intended to be implemented by the developers is referred to as implementation fidelity. According to the National Center of Early Childhood Development, Teaching, and Learning, there are four main aspects of implementation fidelity. 1. Program differentiation. It describes the extent to which critical features that distinguish the program are present. Number 2, program adherence. It describes the extent to which program components are delivered as prescribed in administration manuals. Program component number 3, the quality of program delivery. It describes the extent to which program implementers are being supported and are prepared. And finally, number 4, how well the curriculum implementation has been aligned to the standards. It is critical that instructional strategies are implemented with sufficient fidelity, consistency, frequency, and intensity to ensure a child's mastery of a skill is in place. Children tend to make more gains when teachers faithfully implement the teaching strategies or curriculum. We want to be intentional in all aspects of programming, including the intentional use of curriculum, unit planning, and lesson planning to yield the best results and make a positive impact on the lives of the children that we serve. Ann Epstein, from the National Association for the Education of Young Children, NAEYC, describes an intentional teacher as one who uses their knowledge, judgment, and experience to organize meaningful learning experiences for children that they serve. Intentionality, as described by NAEYC, is being planful and deliberate, knowing what you're doing and why, and being able to explain it to others. Having a vision as an educator, as an administrator, and as a professional. As an instructional leader and director, your role is to assist your teachers in developing strategies and tools to be productive at all times throughout the entire day. Think about implementation of the curriculum in your program and your centers. On a piece of paper, write down the questions listed on the presentation slide and place a check mark next to each one that is currently in place, and place an X next to those areas that are not in place or are areas in need of improvement. Let's go through each question. Our curriculum is aligned to the DC Common Core Early Learning Standards. Place a check if it is, place an X if it is not. Second question. Our program adheres to the curriculum scope and sequence 80% of the time. Place a check if it is, place an X if it is not. Our program collects ongoing assessment information. Place a check if it is, place an X if it is not. Our program focuses on specific goals identified in the lesson plans. A check if it is, an X if it is not. Our lesson plans are developed weekly and are aligned with the curriculum and DC Early Learning Standards. Place a check if it is, place an X if it is not. Our program uses the recommended teaching strategies. Place a check if it is, place an X if it is not. Our program uses all recommended materials. Place a check if this is true, place an X if it is not. I assess developmentally appropriate practices in the curriculum and lesson plans each week. Place a check if this is true, place an X if it is not. Well, how did you do? What are the strengths in your program as it relates to curriculum implementation? What are areas of weakness or in need of improvement? The minimum expectations listed were developed by the National Center of Early Childhood Development, Teaching, and Learning. As you work with your assigned facilitator, you will review curriculum implementation and lesson planning for your program. During each session, we will touch upon and discuss developmentally appropriate practices as it relates to age appropriateness and individual appropriateness. According to NACCE, there are 3 core principles of developmentally appropriate practices. Principle number 1, knowing about child development and learning. Knowing what is typical at each age and stage of early development is crucial. This knowledge, based on research, helps us to decide which experiences are best for children's learning and development. Principle number 2, knowing what is individually appropriate. What we learn about specific children helps us teach and care for each child as an individual. By continually observing children's play and interaction with the physical environment and others, we learn about each child's interests, abilities, and developmental progress. And finally, principle number 3, knowing what is culturally important. We must make an effort to get to know the children's families and learn about the values, expectations, and factors that shape their lives at home and in their communities. This background information helps us provide meaningful, relevant, and respectful learning experiences for each child and their family. Did we accomplish everything we set out to accomplish? Did we discuss the differences between a curriculum and a lesson plan? Did we discuss developmentally appropriate practices within lesson planning? And finally, did we discuss ways to adopt tools to assist teachers in aligning lesson plans to the curriculum and DC Common Core early learning standards? Change doesn't happen overnight, and it doesn't come easy, but we are here to help. Your assigned facilitator will work with you weekly to develop strategies to enhance teacher-child interactions as well as improve lesson plans. Kids Comprehensive, the organization responsible for implementing the Child Care Resource and Referral System, publishes a quarterly catalog for providers outlining current professional development opportunities. The summer catalog is currently available. Please visit the link provided to download a copy of the most current catalog. Reminder, all providers must participate in training on the 12 indicators for health and safety by September 2017. Early Childhood Share DC is an online sharing platform for providers designed to help providers in sharing up-to-date knowledge and information. Over 1,000 classroom and administration resources plus vendor discounts are currently available on the site. To access the site, please visit www.eachc.org. www.ecsharedc.org. Establish a profile, and a team member from EC Share DC will contact you to complete registration. You will need to have your center license on hand to register. Quality facilitators will continue to support you in your completion of Capital Quality's 10 elements included on a continuous quality improvement plan. Previous Community of Practice videos are currently available on the OSCE website, as well as other Capital Quality information. June's Community of Practice will focus on detailed lesson planning and meaningful observations. It will be held June 23rd and 24th of this year from 1 p.m. to 3 p.m. All videos of the sessions will be posted on the OSCE webpage. We are always available. Please follow us on Twitter and Facebook. Visit the OSCE website for up-to-date information. Also, please feel free to contact Catherine Kagera, Rashida Brown, or Pilla Parker for questions related to capital quality.